Three more persons test positive for COVID-19 from Mon Quarantine Center and two from Parent Quarantine Center, taking the state's tally of coronavirus cases to 168. With 88 persons having recovered, active cases in Nagaland now stand at 80. In view of the detection of a number of positive cases, Deputy Commissioner Mon declares Wankau Government College campus and the adjoining ITI campus as containment zones. Prohibits movement of public within 1 kilometer radius of these institutions. And India sees the highest single-day spike of 11,929 novel coronavirus cases in the last 24 hours, taking the total number of infections to over 3,20,922 today. There are 1,49,348 active cases and 1,62,378 people have recovered. Well, hello viewers, welcome to News and Trends, and you're watching the daily news broadcast. Three more persons are tested positive for COVID-19 from Mon Quarantine Center and two from Parent Quarantine Center, taking the state's tally of coronavirus cases to 168, and addition of 5 to yesterday's tally of 163. In a tweet this morning, Health and Family Welfare Minister S. Pangipom said, 5 new cases of COVID-19 positive have been reported out of 232 samples tested, 3 from Mon Quarantine Center and 2 from Parent Quarantine Center. Meanwhile, 12 more patients from Dimapur have tested negative of COVID-19 in their second test. In his tweet this afternoon, the minister informed that all 12 patients have been shifted to COVID-19 care center for further observation and monitoring. With 88 persons having recovered in the state, active cases now stand at 80. In Mon, 6 persons had tested positive for COVID-19 at an institutional quarantine center in Mon town yesterday. Deputy Commissioner Mon Thavasilan K had said that 7 samples were sent to RC Dibrugarh ICMR on 12th June. All these 7 samples tested positive in the TrueNat test and were sent to ICMR for confirmation as per extant protocol. The Deputy Commissioner further informed that the persons belonged to a group of people who returned from Chennai and were housed in an institutional quarantine center in Mon. They are all asymptomatic and were all males between the age of 18 and 32. According to Deputy Commissioner Mon, the positive patients reached Dimapur on 22nd May 2020 and all of them were tested in Dimapur and found negative in the initial test. They reached Mon on 2nd June 2020 after spending 10 days in an institutional quarantine center in Dimapur. They were housed at an institutional quarantine center in Mon. After 7 days, their samples were taken again and tested using TrueNat on 10th June 2020. All 7 were found positive and hence their samples were sent to ICMR Dibrugarh for confirmation on 11th June 2020. 6 out of 7 samples have tested positive in the RT-PCR test, the results of which were received on 12th June 2020. In view of the detection of a number of active cases, the entire Wankau Government College campus and the adjoining Industrial Training Institute ITI campus, where the quarantine centers are located, have been declared as a containment zone. The COVID care center has been activated for the treatment of asymptomatic positive patients. The citizens of Mon district have been requested not to panic and be assured that the district task force and the empowered group of Mon district are taking all possible measures to ensure containment of cases and speedy recovery of positive cases. Public have also been requested to continue maintaining social distancing, practice hand hygiene and wear masks at all times. In this connection and in the interest of the public health, public safety and public order in Mon, Deputy Commissioner Mon Thavasilan K has prohibited movement of public within 1 kilometer radius of the containment zone, that is the Wangkau Government College campus and the adjoining ITI campus. Now, a day after the civil society groups in Dimapur had raised concern over the COVID-19 management and the burden on Team Dimapur in handling the growing number of positive cases from the district, Nagaland government has informed that the earnest efforts are also being made to augment the COVID-19 capacity in Dimapur by coming up with COVID Care Center for management of asymptomatic positive cases and to decongest the COVID-19 hospitals. One COVID care center at SIHFW at Chumugidima to be managed by CIHSR will be functional in the next 2 days, and to augment the capacity of COVID-19 facilities, a 50-bedded COVID-19 hospital has been operationalized by the Assam Rifles at ARTC Shokhove. Informing this in a press briefing yesterday, Government spokesman and Minister Niba Krono said to supplement the medical manpower of Dimapur, 5 medical officers are being deployed out of the 27 doctors that were recruited recently. Further recruitment is in progress and more manpower will be deputed as and when recruitment to newly created posts of doctors and nurses takes place, the minister said. He also informed that the private hospitals are also providing medical manpower in the management of various quarantine centers. Further, many churches, NGOs, and volunteers are selflessly rendering non-medical tasks at various quarantine centers in Dimapur. Krono said that the district hospital Dimapur already has a TrueNat machine which can test 40 tests per day. 2 more Quattro TrueNat machines are being provided to Dimapur district in the next few days to further increase its capacity to test. India saw the highest single-day spike of 11,929 novel coronavirus cases in the last 24 hours, taking the number of infections to over 3.2 lakh today, while the death toll crossed the 9,000 mark with 311 more deaths, the health ministry said. This is the 3rd day in a row that there were more than 10,000 cases of the coronavirus COVID-19 in India, which is the 4th worst hit nation hit by the pandemic. There are 1,49,348 active cases, while 1,62,378 people have recovered and a patient has migrated. The total confirmed coronavirus cases rose to 3,20,922. Including 9,195 deaths according to the ministry data updated in the morning. The number of recoveries are more than the active cases, as 50.60% of the patients have recovered so far, an official said. The maximum number of cases are from Maharashtra with 1,04,568 infections, followed by 42,687 in Tamil Nadu, 38,958 in Delhi and Gujarat with 23,038. In the northeast, Assam has reported 3,718 novel coronavirus cases so far. A total of 1,046 cases have been reported from Tripura. Manipur has 449 COVID-19 cases. Nagaland has 168. Mizoram has 107, Arunachal Pradesh has 87, Meghalaya 44, and Sikkim has reported 63 cases till now. The total number of global coronavirus has increased to 77,78,881, while the death toll has reached 4,30,047 according to the Johns Hopkins University. With 20,74,526 confirmed cases and 1,15,436 deaths, the United States currently accounts for the highest number of infections and fatalities in the world. In terms of cases, Brazil comes in the second place with 8,50,514 infections. This was followed by Russia with 5,19,458, India with 3,20,922, and the United Kingdom with 2,95,828. Regarding fatalities, the UK continues in the second position after the US with 41,747. The other countries with over 10,000 deaths are Brazil, Italy, France, Spain, and Mexico. A total of 275 returnees from various states of the country who arrived in special trains are presently undergoing institutional quarantine at various centers in Zinaboto town. An official informed that 28 persons who arrived on the special train from Trivandrum reached Zinaboto last evening, and all the returnees were taken to the institutional quarantine at Zinaboto Government College. Besides the government college, the returnees are also lodged at quarantine centers at Government Higher Secondary School Zinaboto, Cultural Hall and Town Hall. Around 40 persons who arrived from the northeast region have already completed the mandatory institutional quarantine period and have left for their homes. The official overseeing the logistics and accommodation matters told News and Trends over phone that the district administration is overwhelmed at the support and help from churches, civil society groups, and individuals for the help and assistance right from the start till today. Meanwhile, the church staff of Zinaboto Town Sumi Baptist Church ZTSBC SBAK Aizito, led by Pastor Reverend Dr. Daniel Chishi, today organized a visitation cum prayer fellowship with inmates of all the quarantine centers at Zinaboto. The program, which began at 11:30 a.m., went on till 2 p.m. at all the 5 centers. Pastor Daniel Chishi delivered the word of God to all the inmates. All safety health protocols, including social distancing, were maintained during the course of the visitation.
nung alawo jubse yoro nung shim tani maspene sim ya kham tsine ga nung sa chomlai sim ku ko kum tsine ga nung sa oshimlai ikemo izin
The Zinaboto Town Sumi Baptist Church members, led by Pastor Daniel Chishi, also distributed food packets in all the quarantine centers. The District Task Force for COVID-19 Zinaboto has acknowledged the services of the church members and deacons and informed that ZTSBC members have been providing food to the inmates in quarantine centers every evening for the last 14 days. According to the Department of Health and Family Welfare, out of the total of 80 active cases, 39 persons are at District Hospital Dimapur, 7 are at Assam Rifles Hospital Dimapur, 14 patients are presently undergoing treatment at NHAK Kohima, and 7 are at Chedama COVID Hospital. 9 are admitted in Mon District Hospital and 4 patients are at Parent CHC Jaluki. All 80 positive cases are asymptomatic. 75 persons have recovered from Dimapur District Hospital, 2 from NHAK Kohima, 6 from Chedema Kohima and 5 from Tengsang. With this, the latest figures for recovered patients stand at 88. The district-wise distribution of cases by domicile district are Kohima 7, Dimapur 23, Mokchong 0, Fek 1, Zinaboto 1, Tengsang 10, Mon 33, Wokha 7, Kifri 4, Longland 0, Peren 80 and others 2. According to the Health and Family Welfare Department, a total of 5,945 cumulative number of samples were sent for tests and results for 4,848 have been received, out of which 168 have tested positive and 4,670 samples have tested negative. A total of 242 samples were sent after 3 p.m. yesterday till 3 p.m. today. Results for 1,097 samples are awaited. A total of 434 samples were tested by TrueNat and 397 have tested negative. 2 samples have tested positive and 35 results are awaited. A total of 39 samples were retested through RT-PCR, out of which 10 samples tested positive and 29 samples tested negative. 60 samples were retested through TrueNat, of which 1 was positive and 59 tests were negative. A total of 6,774 persons are presently under facility quarantine, while 8,212 persons are under home quarantine. The Noklak Subdivisional Administration held a consultative meeting with the church leaders, Kamingan Baptist Churches Association staff, pastors and deacons of all the churches in and around Noklak headquarters on Friday at DB Court ADC Noklak to discuss on the matter pertaining to the reopening of churches for worship services. The meeting decided that status quo will be maintained and that the church service will be kept in abeyance until such time when the individual churches are in the position to fulfill the criteria and conditions laid down by the government. The meeting identified the need for seminar training with regards to preparation of disinfectants, from where to source, techniques of sensitization, etc., and therefore decided to approach the hospital authority for assistance and guidance. During the meeting, Dr. Jonwa MO PhD Thonaknu gave a short speech on the impact of stigmatization and discrimination on the COVID-19 patients and returnees. Stressing on the effect of stigmatization and discrimination, he called upon all for raising awareness so as to reduce anxiety and stress that impairs immunity, thus worsening the psyche and well-being of the patients and people in quarantine. That's all we have time for in this edition of News Broadcast from News and Trends. But before we leave you, here's a reminder that you can send in your videos at the WhatsApp number flashed below and be part of this venture of being a citizen journalist. Meanwhile, stay safe, practice health hygiene, and maintain social distancing wherever you are. But most importantly, take good care of yourself. From all of us here, it's bye for now, and thanks for watching.